When I say biomarker, I mean basically two classes of exams. The first class is biomarkers of amyloid pathology, markers of the buildup of amyloid in the brain, amyloid which makes up senile plaques, which is the main constituent of senile plaques. And we have two basic tools. We have lumbar puncture and assay of amyloid in the cerebrospinal fluid, and we have amyloid PET. We have PET with amyloid ligands, and there's 3 amyloid ligands qualified by FDA and EMA already. And then there's a second group of biomarkers, which are biomarkers of neurodegeneration, biomarkers of synaptic loss, which is the consequence of amyloid buildup in the brain and the buildup of the other protein, which is tau, hyperphosphorylated tau in the brain. And markers of neurodegeneration are atrophy, mainly of medial temporal structures, such as the hippocampus, which can be captured by MR, magnetic resonance, and FDG PET, PET with glucose, which is a very sensitive marker of synaptic dysfunction. These are the two main biomarkers, and on top of that, there's also the assay of tau and hyperphosphorylated tau in the CSF, which is an index of the other major pathology typical of Alzheimer's disease, which is neurofibrillary tangles. If you use one or more biomarkers, you might be able to capture Alzheimer's pathology in the brain when the patient has only very, very mild memory problems and yet no disability, no dementia. The patient technically does not have Alzheimer's dementia, but he has Alzheimer's pathology in the brain. And so he or she will develop dementia 2, 3, 4 years down the line. Moreover, with these biomarkers, we can also capture Alzheimer's pathology in completely asymptomatic patients. And we know that they're not patients, they're persons, they're healthy persons living in the community, doing their work, raising kids, whatever. And we know that these persons, if they have amyloid buildup in the brain and the tau pathology in their brain, they will develop Alzheimer's dementia some years down the line. We do not know how far in the future. This is something we do not know, but we do know that they will develop with very, very high risk Alzheimer's dementia in the future. These biomarkers can be used twofold. Number one, to give an answer to persons, to patients this time, to patients coming to memory clinic with concerns about their memory. There's many patients going to memory clinics with memory complaints, with very early memory complaints, very mild memory complaints. Some of them have early Alzheimer's disease. Others, they have normal aging or depression, anxiety, or they're simply worried. With these biomarkers, we can give an answer. We can give a clear answer to these worries, to these concerns, to these complaints. Number one. Number two, by using these biomarkers, we can select groups of patients with very early Alzheimer's pathology in their brain to test drugs anti-amyloid and anti-tau and see whether these drugs prevent the development of dementia down the road.